Knowing how to properly care for your instruments and your work areas is important whether you're in a physician's office, a surgery center, or other healthcare setting. Choosing a cleaning product for your processing area depends on your needs. Often, time is limited and you're not able to wash soiled instruments immediately after a procedure. If this happens, the best way to keep soils moist and ready to be removed is by placing soiled instruments in a basin and spraying them with Micro-Scientific Cuts-It Instrument Spray, or Cuts-It Gel. When ready to clean instruments, rinse the pre-spray off and place instruments in your filled wash sink. For manually cleaning basic instruments and equipment, use a general detergent like Micro-Scientific micro-kleen high suds liquid or powder. Oftentimes, a high foaming cleaner will impede vision into your wash sink. Using a lower foaming product like Micro-Scientific micro-kleen low suds detergent helps create a safe work environment at the wash sink. The Association for the Advancement of Medical Instruments, also known as AMI, recommends an enzymatic detergent. Lighter soils might call for a single enzyme detergent like EnzyClean, or for more complex soils, use a dual enzyme like EnzyClean 2 low suds or high suds detergent. Heavily soiled cases are cleaned more thoroughly with a multiple enzyme like EnzyClean 4. Proper care and handling of instrumentation always begins with good work practices. Make sure to follow AMI standards and OSHA regulations. When working with BioLoad, wear proper protective equipment. No detergent can safeguard you from infection if exposed to contaminants, so protecting yourself is important. Keep your work areas safe and disinfected by cleaning countertops, sinks, and other work areas between uses. Cleaning these surfaces with an EPA-registered disinfectant, such as Micro-Scientific opti-cide 3, will prevent cross-contamination. Wash your hands after working with contaminated instruments and surfaces. Reduce bacteria by using antimicrobial product like Micro-Scientific opti-scrub. Make sure to handle with care and handle products properly. Know the chemicals you're using and make sure to have appropriate information on your products, including SDS, and correctly labeled product with usage instructions. Make sure to date your product once opened in order to follow any expiration guidelines. Never refill a container unless it is a marked refillable bottle. For manual washing, AMI standards recommend a 3-sink process. However, if space is not available for 3 sinks, it is advisable to have at least 2 sinks. One for washing and one for rinsing. In order to fill the washing sink accurately each time it is used, determine how deep your water should be in order to fully submerge items or trays. Fill a gallon jug with water, pouring it into the sink, and repeat until the sink is filled to the appropriate level. Once the sink is filled, make a level mark on the sink with a permanent marker. It is important to note how many gallons are in the sink, so each time it's filled, the correct amount of detergent can be added. A typical dilution ratio would be 1 ounce of detergent per 1 gallon of water. If the label instructs, make sure that the water used in a wash sink is warm to hot in temperature, as this is an important cleaning key, especially when using an enzymatic detergent. You can use a water-resistant thermometer to indicate accurate temperature. When using the Micro-Scientific micro-kleen HS powder, add the powder to the sink while it is being filled, and then mix the sink with your hand before adding soiled items. Soiled items should always be submerged, and cleaning should take place beneath the water level in order to reduce the chance of contaminants becoming airborne. Enzymatic detergents should be allowed some additional time to work effectively by allowing soiled instruments to soak for 3 minutes or more. Wash water should be changed when visibly soiled or when the sink temperature is below product recommendations. Once cleaned, instruments should be thoroughly rinsed in order to remove any detergent residue. Residue may interfere with sterilization and cause stiff or sticky instruments or discoloration. In order to prolong the life of instruments, it is best to perform instrument lubrication every time instruments are cleaned. This can be done manually with micro-lube C. For a lubricant bath, Shake product well, add 6 parts sterile water to reusable container, and then add 1 part lubricant. Keep the bath covered between uses in order to keep product fresh and uncontaminated. Thoroughly air dry instruments or use lint-free towels to wipe instruments off before putting into the bath. Any residual water could further dilute the product and eventually affect the results of the lubricant. Instruments should be opened and then submerged for 30 seconds or more before removing. Allowed to thoroughly dry by laying open instruments on towels for several minutes. A good lubricant will not interfere with most types of sterilization. It will also create an instrument that moves freely and helps prevent pitting and rusting. If spotting or staining does occur, use Micro-Scientific Cool Soak Stain Remover or Stain Away wipes to help quickly and safely remove those stains. Chemicals should be stored in a cool, dry place when not in use. A standard process for cleaning and lubrication should be written, posted, and followed. Following these steps will keep processing effective and personnel and patients safe. For more information on the Micro-Scientific Care and Handling line and for product recommendations, please contact us at Micro-Scientific by visiting our website at www.micro-scientific.com or call our toll-free number at 888-253-2536.